Hello. Today the case is a CT scan of brain, and this is a CT scan of a 60 years male patient who has been suffering from headache, vomiting and weakness for more than 1 to 2 months. On admission he was advised with this CT scan. Actually this CT scan is with contrast. The upper portion of the scan is without contrast and the lower portion of this section of this scan is with contrast. Now without contrast scan, what is the lesion? Please have a close look. Okay. Actually, there is a large heterogeneous. Okay. Yeah, this is a large heterogeneous mass with perilesional edema. This black area is the edema and this white area is the mass, and the perilesional edema is huge. The upper segment, look at here, the upper segment show actually the lesion, perilesional edema. At first look you may be confused that this might be a case of hemorrhagic stroke with perilesional edema. Of course, the hemorrhagic stroke is the first DD, but the provisional diagnosis on this CT scan should be a space occupying lesion in the brain. And with contrast, the segment below, the lesion here actually took very little bit contrast or no contrast. These segments are more or less same as those without contrast. The radiological diagnosis from radiological comment from the radiologist of this hospital, according to their language, I would like to read that report. A large heterogeneous enhancing complex mass is seen in the right frontotemporal lobe region, measuring about 69 by 49 by 41 millimeter with surrounding edema. The mass effect is evident by effacement of sulci, ventricle and mild midline shifting. The cerebellum, midbrain, pons and medulla appear normal. The image part of the eyeball, nose, soft tissue are unremarkable. Okay. The conclusion, the comment is suggestive of glioma in the right temporal lobe region with surrounding edema, mass effect and midline shifting. So as a whole, this is a case of glioma. The first DD should be the hemorrhagic stroke, but you should not be confused these glioma with hemorrhagic stroke. But for academic purpose, you can make the differential diagnosis. So when you see any CT scan with this type of lesion, the suspicion on glioma or ixol should be inside your mind. So thank you very much.